Can everyone hear me? Hi, welcome everyone to our Health Equity Forum. This is the second forum that we're hosting, although our first one was last year at around the same time, virtual. So we're really happy to be able to have this forum in person and have many of you attend and participate in what will be the conversation for today. Last year, the forum focused on COVID-19 vaccination efforts. This year, our goal is to learn and reflect from what we did last year and use that as an opportunity, as the starting point to create a more robust public health system here in the city of Chelsea. So today we've convened a panel of our community-based organizations. We have Chris from La Colaborativa, Sarah from Green Roots. We will have a representative from Chelsea Black Community joining us in a little bit as well. And you'll also hear from our medical providers, our municipal departments, and as well our external partners. So we are looking forward to the conversation. Feel free at some point. We'll have a section for Q&A for you to ask the panelists any questions. And for anyone who's joining us remotely, you'll be able to type in questions on the chat option. Thank you.
Thank you, Flor. My name is Lourdes Alvarez, and I do communication and outreach for the city of Chelsea. And I'm so happy and proud to be here with Christina and Sarah and with Joan and Flor. I feel that we are in family, just talking about all the challenges or the changes and all the opportunities that we went through together during COVID. So on the next 30 minutes, we will be just talking about, in particular, how COVID changed your organization. So let's just start it with the question on your perspective. How has your organization changed due to COVID? And maybe we can start with Chris from La Colaborativa.
Thanks. Can you hear me there? No. Yeah? Can you hear me? Okay. It's weird. You don't know if you're being heard. It's very strange. So thanks, everybody. Thanks for coming. This is super exciting that we're doing this, and maybe we can make this a yearly thing of our Health Equity Forum. So, I mean, La Colaborativa isn't what it was, right? I don't think anyone is who they were before. I think that's what defined COVID. It's almost like we're going to have a time, when we look back in the past, we'll think of before COVID and after COVID, BC and AC, right? Definitely, La Colaborativa has changed profoundly. But I don't want to talk about all the changes, but I want to talk about the changes that I think were important in the city being able to handle the pandemic with La Colaborativa as a participant in that change. And we know that the bottom line of this is that Chelsea was the hardest hit city. And then we went from there as being one of the highest rate of vaccines. And that occurred because we came together. And I think that was a defining factor where La Colaborativa sat down as a partner with the other players that are here today. And this is why we're doing this. But I would definitely say that where La Colaborativa shifted its perspective was in public health partnerships. First in public health, because La Colaborativa had never done public health in that way, and that's kind of how I came on the scene. But also understanding that the door knocking that La Colaborativa has always done, we started doing it in partnership with Green Roots. And we would take the map of the city, which we would get from MAPC, because of the wastewater, and we would say, okay, Sarah, you guys take this, and we'll take this, and we're going to split it up. And then we would meet every Thursday and say, oh my gosh, look at the rates here. They're not doing well enough. We're not getting enough increase on this population. We want a better increase. How are we going to troubleshoot that? So as a team, we would sit down and go through those questions. So I think collectively strategizing is something that changed in how we approached public health. From La Colaborativa, when I first came on, there was a group of health promoters that were going door to door, and Brenda and Ice were part of that team. And what changed was we started thinking about how are La Colaborativa health promoters part of this bigger picture. And the other thing that La Colaborativa shifted into doing was understanding that, and I think this is obvious to all of us, that COVID isn't just a virus. It's a revelation of societal ills. It's a catastrophe in that people lost housing, they lost food, they lost jobs, they lost their security, and so they lost everything that they were standing on before. And what La Colaborativa tried to do then was to adapt into addressing these needs. It's impossible to address all of them. But the most poignant and the most important were food and housing. And when we talk about what's next, I think we're going to go into that. But definitely focusing on food and housing as survival mechanisms. And then within that, understanding that delivering food and supporting housing security in Chelsea requires being part of a social network. So I'm going to go back to, you know, it's not just being part of the families, it's being part of the larger partnership of what is Chelsea, right?
Yeah, and maybe Sarah, if you want to chime in on that from Green Roots.
Yeah, cool. Thanks everyone for being here. It's nice to see everyone and be in community with you all. I think, Chris, a lot of what you said seems really similar to Green Roots as well. I think one thing that stands out to me is like understanding public health within the larger ecosystem of like environmental justice too. And I think COVID gave Green Roots the opportunity of really understanding like what are these connections between environmental justice and health? Like how do we think of exposure to air pollution, air contaminants and things like that and understand that within the context of public health, right? So really trying to solidify those connections felt very important to us throughout the pandemic and something that we will continue to do moving forward. I think the other thing too of like, okay, John. Hi. I think like establishing a clear and dedicated program within Green Roots to focus on health. We also had not been doing public health work before, so hiring a team of ambassadors who were doing door-to-door door knocking and that kind of stuff, doing phone calls and outreach felt really important to us. And I think the pandemic exposed maybe certain vulnerabilities within our healthcare system, but also showed us what really does work in Chelsea, and that people love having these door-to-door interactions, bringing public health information right to people's door, connecting with them at that human and personal level. So bringing that type of organizing into all of our work moving forward seems really key.
Yeah. So. Welcome, Joan.
Hi, I can't breathe.
So we are just talking about how during COVID, La Colaborativa and Green Roots has changed. So if you can share also how the Chelsea Black community has changed due to COVID.
Okay, I still can't breathe, but I'll get it together.
Can give her water?
This is earlier than I expected, but thank you. So, hi everyone. Sorry, my apology for arriving a little late, but I took out a few cars to get here because I thought it was that important, so glad to be here. I feel that my name is Joan Crummell. I'm president of Chelsea Black Community, and I believe that COVID forced us to think, rethink, and troubleshoot in figuring out how to improve access to preventative treatment, like the vaccine, for many different pocket neighborhoods and groups of our residents within our own city. I think it also shed light on surrounding communities in terms of how largely interwoven we are, and that was a great lesson, because as individual organizations, you know, we kind of tend to focus on our drive and our goal and our aim. And then once you get there and you see the bigger picture, we're all interwoven, we're all as one. So that was a lesson learned, embraced, and I think we prevailed as a community moving forward with those intentions, just remembering that there's a larger community than our inner community. I also believe, I wasn't done.
No, sorry.
All right. I also believe that COVID reinforced our beliefs that success in policy rollout for health, prevention, and intervention is multi-layered and has to hone into on conclusion. It has to focus on conclusion and not making any assumptions or conclusions. So that was a big one. And the last one was COVID allowed us to shape our way of thinking in regard to how we prioritize the who and the where is needed in what's needed greatest in our community. I believe that the who had to include all race, ethnic, and gender groups, and the where had to include the social, physical, and environmental components. We now know that in order to have accomplished almost 93% vaccinated rate, an interpersonal connection to promote wellness has to be achieved. Thank you.
No, that's and now that thinking in all these things, and we are now thinking how we move forward. So my next question for the panel to have some discussion is, what does your organization will need to sustain this public health work that you have developed during the pandemic? But also a very important question on how we can sustain the will to continue working together and learning from each other, because that was critical during the pandemic. And we did it pretty good, and now we are an example for everyone. So how we continue with this collaboration in the future. So I don't know who wants to start. Maybe Sarah or
Sure.
Chris?
I can start, yeah, I don't mind. I think one thing that seems really important from the partnership we have is like figuring out how do we rely on each one of our strengths and like how do we use that in working together. So I was just thinking over the past year, right, we were always waiting for Floor to send us consistent updates from the city. Anytime there's a change that happens at the state level or the city level, Floor calls us and texts us and let us know immediately so that we can like shift our strategies and shift what we're doing to like follow the latest guidelines, which is really important. And I think another thing that felt really important is like having Chris around to help train our ambassadors and do workshops for them and teach us like what are all the different public health strategies that we may not be aware of, or if there's somebody who is interested in learning about COVID and the vaccine within a religious context, sending them to all the events that Joan and Sharon have been putting on. So really figuring out like what are the different strengths that each of our organizations brings to public health work, and like how do we keep relying on those strengths and working on them together. And I think the other thing that feels really important moving forward is like having 2 or 3 or 4 key health priorities for all of us. I think the reason why COVID and the vaccine why the vaccine was such a success in Chelsea was because like we all had this one goal together, right? Everybody's goal was we're going to get as many residents vaccinated and then boosted as possible. Like that was the overarching goal for all of our organizations. So having 2 or 3 key health priorities moving forward, where we're like, okay, these are the health priorities that we're all going to be working on, even when we're faced with other competing priorities from our organizations. Can we commit to dedicating staff time and hours and work on those health priorities?
Absolutely. So Chris or Joan?
I'm going to jump right off that because I think the next piece of what you just said, which is exactly what we've all talked about, is how do we do that? And the thing that I keep reflecting on, because I get asked about this a lot, is how is it? How is it that we got along so well? How is it that we move so quickly? And that has to do with trust and relationships. And, you know, one of the things that I've said a lot is that Sarah, Flor, and I were new to Chelsea. We kind of got thrown in this thing. And we're like, go, solve, help.
I was new too.
And it was like, okay, you know. So we ran forward. But I would definitely say that in order to maintain the trust that was established, we need to work really hard on the consistency and the ritual that made that trust be present, you know, and like even Greg and I used to have Thursday morning check-ins when we had the vaccine clinic of like, you know, this is what we need to work on, and we need to work on this. And I would definitely say that especially during a time of Zoom, when everybody was so disconnected interpersonally, I felt that the fact that we had Thursday morning check-ins with the public health group and Friday morning check-ins with the Chelsea Project, that just created this consistency of we keep coming back to this, you know, almost like this sacred ritual where we come back to this every week, every week, and we build on it. And that built so much trust that we know about each other's kids and lives and transportation problems and construction in the house and, you know, stuff that I think is part of having that trusting relationship. So I would say going forward we have this vision that we'd like to focus on a few things for Chelsea that we can all do really well and deeply. And we need to do that by consistently continuing these relationships and having these meetings. Making sure they're fun so that it doesn't become like, oh God, not again, the Thursday meeting. I hate this meeting. Why do I have to be at this meeting?
But that's super easy. It's always fun working at Chelsea. So we had a lot of fun.
And then part of that trust is knowing that, as Sarah was saying, we're all part of this larger system. So being able to say, okay, so you take this piece, you take that piece, you take this structure, and all of that together is the machine that's going to make this work.
Yeah. Joan, what
Right.
do you think?
I think they're right. But I also think that, as they said, it's based on trust, commitment, and respect amongst the organizations in between us. We really do like each other, so that's a good thing. And I think in terms of CBC, because often, you know, we wear many hats and have many jobs, and sometimes we're not always at the table, but I appreciate the updates, and I just love that. I like the boots on ground approach. So what's coming through the pipeline, we get it, we hear it, and then you go out and you basically accomplish that goal. So I think we couldn't have done it alone. I think that the organizations and the other organizations that added to that was perfect. I do think we need to continue to be part of the conversation, input and decision-making. I think we need to be mindful in transparency. We need an intentional focus on open communication and willingness to reach out and connect with all members of the community. And I think it starts from its base. So we have lots of residents that belong to all of our organizations. And I think as leaders, we set the tone and set the message, and it works. And I think I don't even need to continue to talk about the organizations and the success of them, because we are a reflection of that. Our vaccine rate, what's happening here in the city, our addressing the needs, is reflective of communities working together, community organizations working together and being successful at what they do. So thank you for partnership.
This is Sharon. I was wondering if I could comment just a little bit also, if possible.
Yes,
Lourdes?
we are here.
Yes, I'd just like to say that I work with the Chelsea Black community, and all of the three of us organizations here work directly with health resources in action. Mm-hmm. But when we have meetings, we can tell from the information that we bring back what we have done. I hate to say it, but we're leaders, though. The work that has been done in the city of Chelsea has been some of the best, if not the best, across the state among this group of 20 low-income and poor cities. Mm-hmm. Definitely, and that's without a doubt. They always tell us that. We've had some exceptional programming, and even at the Chelsea Senior Center, we practice what's called best practices. That's being kind to the people that we bring in, reaching out to our neighbors and friends to see if they will come in, and they have come in, because you can tell we're 93% fully vaccinated in the city, and just being the kindest reps that we can for this organization. And it started with leadership from the top. We have Tom Ambrosino, Floor, and others that work with us that are working their butts off to make sure that this works, including the folks at the community-based organization. But it has worked so well. We want to continue this, and we're planning to continue this as long as possible also. Mm-hmm. So that's just some of the comments I'd like to say in this area. And we work so well with the other two organizations, Green Roots, La Collaborativa, and the CBC has really done a wonderful job in making sure that this positive work has happened for the city of Chelsea, folks. Thank you.
Thank you, Sharon. And yeah, I think that right now we have a huge responsibility, because we need to keep this effort.
That's right.
So I usually think this COVID as a great opportunity to bridge a bridge between the community. And I remember when I started here in City Hall, we were talking a lot about trust, and we were doing census outreach. And I say, no one trusts in government. And
that's
now,
right.
2 years later, 3 years later, we did success in the census, and we did a lot of outreach for COVID, And that was a huge success because of the partnership, but also because we create this very fragile, because don't think that this is going to be permanent. This is something that we need to work every single day to sustain. Because in the moment that something fails, the whole trust just goes away. So now we are thinking on going forward in the public health planning, and we only have a few minutes left before we open for questions to the public. So in each organization, what are you're advocating for? So what's next for you? And who are you advocating to? And no less important, and how you are advocating with. So I don't know who wants to start running this.
Joan should start, because then you have the third.
Okay.
Because we all started once.
Yeah, that's
All
fair.
right. All right. Simply, CBC advocates for both core public health practices that promote wellness and growth for residents, such as equity, social justice, participation, and the 3 A's: acceptability, affordability, and accessibility, as well as advocacy for post-pandemic areas of concern. Residents have spoken on that continue to have devastating impacts from which many have not recovered yet. We look at who, the second question was who are we partnering?
Who are you advocating to?
For?
Two.
Two. Okay, we're advocating for folks here in this room. We're advocating to folks here in the room, residents, other community stakeholders, and all who are willing to listen and interested in promoting a healthy Chelsea. Third question?
Who are you advocating with?
With our partner organization. Voila. Residents, again, stakeholders, hospitals, schools, churches, and everybody else who wants to be a part of building a productive, healthy, safe, and educated community in respect to public health. Thank you.
Thank you.
Yeah, I think in terms of programmatic areas, like what we're doing moving forward, is one of them is air quality. So whether that's advocating for air filtration systems in schools or in homes, working on and creating an air quality task force for the city, or an air quality study with BU and MGH. That's a big area for us moving forward. And I think the other thing of like who we are advocating with is, of course, you all are partners and everybody in this room, but also our residents, and like taking that next step of advocating to, like, taking it away from only legislative advocacy and working with representatives and city councilors, but also that next step of like, how do you build power within your membership, within your communities, bringing everybody who we were door knocking to and everyone that the ambassadors have been talking to over the past couple of months, how do you bring them into this fight too, and make sure that you're listening to and being receptive to their concerns, so that you're able to change, so we're able to change our public health strategies.
It's hard to follow these two women. So programmatically, in terms of La Colaborativa, we are going to continue our COVID work because we know it works, and we have a lot of fun doing it. And Priya and Greg at MGH in East Boston already started getting emails from me about the fall. So we know that works, and we know that we can activate it in a minute. So we're ready to go. You know, we're waiting for Barry to tell us wastewater levels have gotten too high, and we'll be on the ground again. And we know that we have the rest of the community to support us on that. We've started expanding into mental health issues, and most of you know I did my doctoral dissertation on COVID in Chelsea, and one of the things I learned in that dissertation was that access to therapy as a one-on-one thing is not actually appropriate for people over 29 in Chelsea. It definitely people under 29 were using it, but people over 30 were, you know, it's just not culturally appropriate. And so we're trying to design mental health fun things that are going to impact people's mental health. So we're working with East Boston, doing yoga, peace circles. We're going to start Zoom classes. We really want to activate the fun. Let's have a good time. And if we come together as people, specifically as women as well, as heads of households, we know that's going to create the support networks that already exist and just strengthen them. You all know that La Colaborativa is working hard on housing issues, both eviction and the quality of housing. I'm not going to get into that because there's going to be a whole panel on that. And food, so our food pantry is famous, and we're actually shifting into a food sustainability program. So the survival center that we're rebuilding, is going to have both a nutrition program and a kitchen where people who are cooking in their homes, like making tamales and trying to sell them, they can actually have, an industrial kitchen where this can occur. This is part of our wraparound services model. And I think what La Colaborativa has understood is that health is part of everything La Colaborativa does. And I think this came through into all of the organizations. And we're advocating, and I really liked what you said, because that's what we were thinking about, is that we're advocating up, and we're also advocating across. We're advocating to the community, to Chelsea. You all know that La Colaborativa has an amazing capacity to fill up City Hall with people when we need something passed. But we're also talking to Elizabeth Warren and Ed Markey to remind them that COVID's not over, and to remind them that there's a community that's holding them accountable for that. And we're advocating with our Chelsea partners, and we're also advocating with our Massachusetts partners. So there's, like Sharon was saying, there are 20 other communities that are concerned about this. And so I think that these networks that are existing, we're definitely in next year, we're still going to be tapping into them.
Yeah, absolutely.
And that's why you're all here, because you're all here to advocate with us.
That's
right?
Yeah. And it's working in a city, everything is to be done constantly. So also we need to reinvent so many of our programs. So I think that we will have a lot of work, but also a lot of fun ahead. And I want to acknowledge, because everyone that is here in this room also did a part spreading the word during COVID. So we really, really want to thank you for all your hard work. Because I can recognize so many. Oh, we need to, yeah. Sorry, yeah. So personally, I'm super happy to work with you all, and really thank you for all you have done for the city of Chelsea. And guys, what you say about you is thank you also for all your hard work. And we are looking forward to continue working together. So now let's open the mic. If someone has any question from the public.
Lourdes, this is Sharon. I have a comment.
Okay.
Hopefully it's time now, because I may not be able to stay on to the end. But I'd just like to say that I think the work that we've done should be publicized across the nation. I hate to say that, though, because no other communities, I bet, across the U.S. have come together like we have here in Chelsea. And I'm just learning from experience. I talked to recently, my home is Mississippi, as you can tell from the Southern accents, but I've lived in Chelsea alone for 33 years. I did talk to the folks in Mississippi, and I said, what are you doing about COVID? And they were telling me they're driving 15 miles to get a vaccination. Yeah. The vaccination rates are low. There's no organizations that have come together in any of the cities that I know in that state to do what we've done here. So there needs to be a way that this project that we've done can be exemplified in other countries, other cities, other states, because it needs to be done this way. And they can end up with the 93% vaccinated as we have also, or more. But just to push the work that's been done in Chelsea, it serves as an example for the nation, in my opinion.
Yeah, and thank you for bringing that up, because, yeah, when we talk about disparities, we usually think on our own disparities, but also we are part of a country that is very unequal. And, yeah, so we are also the symptom of how unequal our society and our country is. So thank you for that, because, yeah, we are in disadvantage, but we are not the only one, and yeah. So any other question or comment?
Yeah, I just wanted to add on to that to say, although, we up here and we're an example of organizations coming together for a common goal, there are so many, as Lourdes said out there, like Yahaya, who, gets the message out. So there's so many tentacles to this solution, and arms that are working, and Dan and Ron and La Colaborativa, the youth are out there, and Green Roots, and I see and Mitigate just showing up every weekend, and Hassan and Tariq and all of you and Melissa. And I just want to say I appreciate you. I appreciate this community, born and raised, loved, and everything, and came back and will continue to give back. But it's perfect because I think it was a storm, but we had the perfect team to respond to the storm. And that's what makes a huge difference over and over again. Like, we are the poster picture of success in response to the pandemic. So give yourselves a hand.
Woo! And also we have Sarah in the public that she's organizing the research event. So that's going to be in May. So when we have that information, we will circulate it with you because we need to show what all the work that we have done in Chelsea, and we have a lot of research happening here in Chelsea. So this is also another effort to show what we are doing, and also to keep informed on where we are as a city. So we need to.
Sorry,
we
could I just acknowledge one more person?
Yeah.
Public health nurses forever.
Yeah,
right?
Paula,
So
our
Paula
superhero. So we can continue talking and talking and talking, but we have another panel. But thank you so much for being here today. I did my best.
Good job.
We'll see you. We'll see you next time.
Okay, great. So I have the distinct honor of introducing and moderating the provider panel, and these are the healthcare institutions that helped us, despite everything that doctors and nurses and everybody else who works in a hospital system has gone through in the last 2 years. These three institutions were key in making sure that Chelsea got tested, Chelsea got vaccinated, and people who were sick from Chelsea got taken care of. So I don't think we can thank them enough, really. And our success really is on your shoulders. So the way that we're going to do this panel is that each one of the panelists is going to they're going to go through slides, and then we're going to go through some questions, and then we're going to open it up for questions. And I want you to think about, as we're going through the day, the vision for today is to think about, okay, we did really well in COVID, great, thank you very much. What are we doing next? So that we can continue being the star of response in general, and we can start picking Chelsea up holistically in a way that changes the outcomes of Chelsea as a community, and that's what we're going for. So the big question to you three is, how are we going to do this, guys? But we'll help, don't worry, but you'll help us. So I'm going to start by introducing Priya. Priya Gupta is a physician at MGH, and she was the goddess of mobile vans. And I'm just going to let her talk. So welcome, Priya. Thank you.
Thank you. Thanks for the kind introduction. It was certainly a team effort. My name is Dr. Priya Serene Gupta. I'm a primary care physician at Mass General Hospital and the medical director for the MGH mobile program, and now also the medical director for Mass General Brigham's community-based clinical programs. I'll talk a little bit about what we have been doing on mobile and some of our plans going forward. And really, the plans going forward are somewhat iterative, and looking forward to everybody's feedback, this group's feedback on ways that we can fine-tune that direction and make it most appropriate for this local community. Next slide. So again, I'll talk a little about the provision of services during COVID, how community engagement and engaging with all of you was key to our work and really the backbone of our work. Some of the successes that wouldn't be possible without many from this group involved in these efforts. Some of our lessons learned, and then really our next steps and some details on what our next steps will look like, so that you can best inform and advise on some of what we have planned coming up. Next slide. So For the last 16 months or so on the MGH mobile van, we've been providing COVID PCR testing, rapid antigen testing, as well as added treatment, oral treatment provision back in January, and then also COVID vaccinations since May of last year. And on the Mass General Craft mobile van, to date we've given about 8,000 COVID vaccines and completed about 5,000 tests. Within our system, Mass General Hospital had one van, which I was responsible for, and then two other vans sort of grew up independently, responding to their local areas. So North Shore had a COVID care van, and then the Brigham had a van. And collectively, across all three vans, we have given 17,800 COVID vaccines in the Boston area to date in communities like Chelsea, and also completed close to 10,000 COVID PCR tests. Next slide. And so the backbone, so the way that the MGH van got started was we got a small NIH grant to increase access to testing in most vulnerable communities in this area. And a big part of our work was community engagement. And so, this sort of lists all the different communities that we've really engaged local partners with and met with commissions of health. We, as we're building on this, with our work that's coming up, there's something like 90 different key stakeholders that, myself and my team are reaching out to share what we have planned, but also to get input from different key stakeholders. But these are some of the local community partners that we've worked with. And in Chelsea, La Collaborativa, City of Chelsea, Chelsea Board of Education, ROCA, Green Roots, just to name a few. Next. And then just wanted to highlight some of our successes. Again, wouldn't be possible without the efforts of so many in this room. But through our vaccination efforts and using community engagement and key stakeholder engagement as our backbone, we were able to be vaccination standout in Chelsea, especially when it came to looking at adolescent vaccination rates. And then when the pediatric vaccine, 5 to 11-year-olds were approved in the fall, we had a similar positive outcome, most notably in Everett, where we were in all of the different elementary schools multiple times and ended up providing vaccination for something like up to 30% of the Everett children that got vaccinated. Next slide. So through this work, we've learned a lot of lessons about mobile health, and as a physician in a large system, I've been taking some of these lessons back to the system to get continued funding and support and infrastructure to keep doing this work in communities such as Chelsea. And that is that, mobile health can decrease barriers to healthcare access and help address social determinants of health. Since the beginning of our work, we've been doing a standardized social determinants of health screener to every individual who's come on the van, and that is the same screener that we use in my primary care clinics. And anyone that has screened positive through that screening, we were able to connect them into our community health worker pool for intake and services. And as we've looked back at that data, we've had some pretty good outcomes. And most notably, mobile health can support equity. Next slide. So our next steps for the mobile service line is, so all three vans that have been that grew up sort of locally in each of the hospitals within our system are coming under one umbrella, under Mass General Brigham. And next slide. Our plan for MGB Mobile 2.0, as we're calling it now, not quite the official name, but just how I'm referring to it, is that we'll continue to have these three vans, and we'll have entity leadership helping to set the strategy along with community engagement to help inform the strategy, and then each of the vans will sort of be locally operating in their catchment area, so that the same van that that Chelsea is used to having in the Chelsea community will be in Chelsea. And we will be out in the field 20 hours a week, at least initially, with each of the vans, doing 5 mobile clinics per week. And as COVID sort of stabilizes or stays somewhat at bay, we are transitioning into 2 other areas. One is cardiometabolic conditions, specifically hypertension, with quickly transitioning into diabetes care, and then in the summer hoping to add substance use disorder care. And the idea will be to have walk-in visits as well as some scheduled visits. The scheduled visits will be existing MGB patients, but we will see all comers, and we will be working with local health partners to figure out ways to do warm handoffs back to individuals' regular medical homes, and serve sort of just as like a bridge to care for folks in Chelsea. Next slide. And really the idea is on mobile to implement something that's data-driven, community-informed, and research-backed, to really show measurable effects and partner with primary care, both within Mass General Brigham and then also with the local health, the other health institutions, to produce a collective impact, and really all this through an equity and health justice focused lens. And again, so our next foray, in addition to COVID, is going to be to add hypertension into our menu of services. And this comes from having looked at the data for our surrounding communities and looking at what is it in these vulnerable communities what are those health areas that are causing excess mortality? And time and again, what comes up is cardiometabolic conditions such as hypertension. Next. Sorry, you can go back one slide. And go forward one slide, sorry, thanks. So we're gonna build this new program based on lessons learned from the work that we've been doing, and really focus on hypertension. Next slide. And so, as I mentioned, we'll be providing clinical services as well as risk reduction services and community outreach. So while a van is out there in the community, similar to what we were doing with COVID, where we were doing testing and vaccinations, but we were also handing out care kits and providing education about vaccinations. Next. And our outcomes measures around the care that we're providing is coming from American Heart Association's Life Simple 7 metrics. And that's what we'll actually have on site, some point of care testing around lipid panel and A1C, as well as the provision to do phlebotomy if needed. We'll assess individuals that come onto the van for physical activity, smoking cessation, diet, and have plans to incorporate a community pharmacy model on the van. Right now, we'll continue using our existing vehicles, but we are in the process of ordering 3 RVs, Winnebagos, that will look like medical clinics when you step inside them. And I'll go into that in a little bit more detail in a couple of minutes about that. Next slide. And so who will receive services? So patient recruitment, this is, for the next 6 weeks, one of the things I'm focusing on in addition to the community engagement. So it'll be Mass General patients who will be recruited through a registry-based system, meaning, we are able to take our 1 million primary care patients within Mass General Brigham and focus it on areas like Chelsea and see who has uncontrolled hypertension. This program is being fit into some of the other programs going on in the system to help in this area. And then for non-MGB patients, we'll do walk-ins. But for the non-MGB patients, a big part of our work the next 6 weeks is really partnering with the local health institutions and figuring out a seamless way to do this like warm handoff, because what we're not trying to do is, take anybody's patients. It's really to engage people in care and then really just plug them back into their primary medical homes. Next. And so this is like more within our system. We have a couple of different programs going on around hypertension, or starting to go on around hypertension. One is this like remote blood pressure monitoring program. One is this program just involving the community health workers, and our program is sort of different. It's really to reach those folks that don't have hypertension at goal, but also aren't necessarily engaging in any of those other programs. Next. And where the vans will go will really be informed through key stakeholders, the literature in other parts of the country where they've worked on hypertension in vulnerable populations has shown things that have been effective, like showing up at barber shops and hair salons, because sometimes the folks that don't have controlled hypertension also don't have any symptoms from it, and you look at this like subset of a population, which is sort of males in a certain age that are otherwise pretty healthy, but then have high blood pressure. And sometimes the way to reach them is to show up with the mobile van in places where they're regularly going to anyways. And we sort of did this with the COVID work in Chelsea, where, last summer, almost every Sunday, we were at the Chelsea fields, at the soccer games, so just kind of showing up where people are at. Or we did a vaccine clinic last year in Chelsea at a music festival, not too far from here. And those seem to be effective ways to really reach people where they're at in the community. And especially those that won't otherwise necessarily engage in care in the brick and mortar. Next slide. And so this is what our van looks like right now. Next slide. Actually, sorry, and I think we can stop the slides and I'll just say a few more words. So we were, I thought I'd put in a layout of what our new van will look like, but we'll send that along once that's a little bit more finalized. But all that to say that, as we're going into hypertension, cardiometabolic conditions, and then in the future other health conditions, we're looking for ways to partner with all of you that are here and to get your input on really, like what the need is. Because as much as there's going to be some central effort, there's going to be a lot of local customization. And so, it might not, there may be some health conditions where that they aren't so relevant to Chelsea. So when we're doing our clinics in Chelsea, we can focus on what the need is here. One other thing that we're building into our more permanent vehicles is a telemedicine booth. So it's going to be a soundproof booth, which will allow for individuals to get, especially our vulnerable patients who are most affected sometimes by the digital divide, to get on-demand care for whatever their care is by just, coming to our van and accessing the telemedicine booth to do a telemedicine visit with an appropriate specialist over in the brick and mortar facility.
Thank you so much, Priya. We're excited for these vans. So next I want to introduce Jose Camacho, who's here from the BI, from Beth Israel, and you can take it away.
Hi, good afternoon. My name is Jose Camacho. I am the practice administrator for the COVID testing sites of all BIs. So, so basically, I was invited. Unfortunately, I've been at the Chelsea site for under about a month now. So some of the data, unfortunately, I'm sorry to tell you, but I just don't have all that data in front of me. But I am a proud Chelsea past resident, born, raised, and grazed here, right? So I want to thank my two counterparts as well for everything that you've done within the communities. Myself, I just came from the Bowden Street community, which is, I understand the disparity. Moving forward, basically, we're going to just be going over the health equity forums and just basically the public health and strengthening of what you folks are basically speaking about. Next slide, please. So, basically with us is how do you think the institution implemented an inquiry lens in the approach to the COVID testing, the vaccinations and the treatment in Chelsea? And I believe that as we spoke, we've been speaking, is listening to our key stakeholders. When they said that it was serious, we took their word. We just didn't go on the fly and just say, no, it's not that serious. We really listened to our stakeholders. We also acknowledge the input of social determinants in health in Chelsea. We understand that there is a lot of things that, unfortunately, many of us in this community did not have even prior to COVID. Like I said, I know what that feels like. I'm from this city. I grew up in that same disparity, so I understand that. And then, of course, it's also allocating our resources and understanding that we have them and be able to tap into those collectively as one unit. Next slide, please. With us, it was the organization able to address rapidly changing needs of the Chelsea community during the COVID, and what did you learn from this? As we all know, unfortunately, COVID would change, right? So the response to COVID would change on a day-to-day basis, from having numbers at an extreme to basically changing how we were doing things on a daily basis. So staying nimble was one of the biggest things, is just the flexibility to be able to understand that we need to be able to respond to this and very fluidly within our environments, because not just the COVID, but also other things that were happening within the city. And also leveraging our existing and new relationships, understanding that we're not reinventing the wheel, we're actually just basically tapping into those same wheels and just augmenting some of these processes, right? And overall, what do we learn from them? I think the power of collaboration was one of the biggest things. I think that everybody kind of just put their chips off their shoulders off, right? And everybody kind of took off their jackets off and said, okay, let's just roll up our sleeves, and this is one unit. And I think that's the only way, and I believe in now, that's the only way we're going to be able to survive this whole entire situation as it continues to evolve, unfortunately. Better understanding creates better service, and I really understand that. We have to listen to our community when they speak and they ask for certain things. We have to understand what that need is and then evolve with that need. We just can't throw out these programs and throw out these numbers, and if we're not listening to the community of what it is that they really do need. What I believe you need has nothing to do with the crisis that is actually happening in the backyard. Next slide, please. How will our institution work to address inequities in the So Chelsea going forward. So again, I think that and I say this very wholeheartedly, growing up in the city, I understood what it meant to be part of that. I take that and I run with that everywhere that I go, no matter where it is that I go. And I think that keeping our community counterparts informed them with the current and future researchers. So my goal and our goal when I came into the BI in Chelsea is that we need to be able to work with some of these researchers that are coming into the city and seeing what it is that they want to basically, what their goal is in their research. But then once we understand those, to be able to get that information out to the community and to our counterparts as well. All right? Engaging in the research will allow us to support more improvements. Just like anything else, research is data. Data will give us exactly what it is and why some of these, whether it's a program, whether it is a service, how do we tap into those services once we understand that we need this data and it shows the need of whatever service it is that comes from that. Next slide, please. How we will continue to work with the local community-based organizations and the government and issue advocacy. The only way to get out there to understand what's going on is to basically put it out there and then be very transparent and very fluid and efficient in doing that. And that is, it's getting on the ground and getting boots on the ground and getting out there, right? I've had again, living here, the opportunity to have worked with both directors of the La Colaborativa and as well as with the grassroots, and both very powerful women that run those organizations have been one of my pieces of understanding what it is and how to get into this community once they understand the trust, and you need to show them the trust because nobody's going to come into the city and just open up their doors if you don't understand where they're coming from. So you understand their yard, understand their lingo, and you understand their need. And the partnerships. With that being said, as well as the partnerships that we have created within this community, whether it's governmental with other facilities or just in general, whether it's churches, local clubs, is using those folks and using those organizations. Again, let's not reinvent it. Let's just work together to basically get the common goal, right? Next slide, please. And pretty much that's it on my side, but I would like to just finish off saying that I am not only proud to be actually sitting on this table, it's an honor to be actually here. It's a big circle for me, personally. I know what it feels like to basically sit there and test 300, 400, 500 people and not see your own family every single day. I know what the disparity feels like when you go home and you don't know what's going to happen. I understand what it feels like to open up your fridge and not understand what's inside that fridge tomorrow. Unfortunately for me, Unfortunately for another community, I was basically deployed to a different location where I was needed. I still have family in this community, and so I know the need. I was part of, even though I wasn't in it. So I just want to say thank you to every single person that's inside this room, personally, because I know that some of you touched many of not only my friends and family members, but many other folks that were just scared to just open that door. The struggle is real, right? And so with that being said, I just said thank you. Thank you.
Thank you so much, Jose. And finally, I'd like to introduce Greg Wilmot, who is the CEO of East Boston Neighborhood Health Center.
Wonderful. So good afternoon, everyone. Again, my name is Greg Wilmot. I am the President and CEO at East Boston Neighborhood Health Center. Very much a privilege to be here, and I look forward to sharing a few things with you guys. So I do have some slides that we'll go through. While we wait, in the interest of time, just a little bit about East Boston Neighborhood Health Center for those that don't know us. We are the largest community health center in the state, among the largest community health centers in the country. And community health centers were founded on the premise, the understanding that we needed to create greater access to healthcare services in our communities. And so we were built with the intention of serving the community and creating access and opportunity in our communities. In the interest of time, I'm going to bounce around a little bit, so if you guys could help, kind of follow with me, just because I'd love to have the conversation. I'm going to ask if we can go to slide 5. That's okay. So just a little bit of where we started. We started with data. East Boston serves nearly 90,000 patients on an annual basis. The communities that we serve the most patients in are East Boston, Revere, and Chelsea. So as the pandemic got underway, we knew as a healthcare provider where we needed to be, and just knowing what happens when any catastrophic situation plays out in our communities are the most impacted, and we're the communities that suffer for the longest, coming out of these types of events. And so for us, our immediate goal was preservation of life and making sure that we could reduce those impacts in our communities and limit the amount of time that we were going to be suffering from this. So our next slide, please. I'm actually going to ask you to go to slide 8. So our strategy was a fewfold. We really looked at, number one, as a healthcare provider, we needed to be able to treat people that had COVID-19. So we immediately made sure that our emergency department, we're one of the few community health centers in the country that operates a 24/7 emergency department. We got that emergency department aligned to COVID treatment and making sure that we could detect that illness early and help folks with those next steps. Since then, we're one of the largest prescribers of COVID oral antivirals of providers of all types, including community health centers, and we've really served as an example both locally and across the country in that regard. We stood up COVID testing sites, not just in East Boston, but in other communities, and served as a testing site for the city of Boston. So we were setting up mobile testing sites. We had a drive-through testing site in Revere. It was really important for us, knowing just how challenging this illness was in our communities, to get folks tested and get them the information they needed. We've since done over 200,000 COVID tests since the start of the pandemic. With regard to vaccine, there's just so many moments and stories I could share. I won't do that in the interest of time, but we've had our moments, Chris. We've moments with many of you just trying to work through this. And I would say at least what was key to our success in this was approaching the work with a level of commitment and intention, but also a great deal of humility. It was important for us to be able to listen and learn, and we certainly did that. And I do want to just extend a thank you to the collaborative who provided us a space to be here in this community on 318 Broadway, to create a vaccination center here in the community, but also as a thought leader and thought partner as we try to navigate the ins and outs of this. But since the start of the pandemic, we've administered over 150,000 doses of COVID vaccine, and that has been largely concentrated in the Latino, Latinx community. What we did, knowing what we wanted, where we wanted to be and what we wanted to do, we really tailored our systems to expressly serve the Latino community. We had an online registration system for accessing vaccine. We restricted those appointments to people that came from our core communities. We did early promotion to Latino families. And the idea there was, just with all the challenge, of accessing these services, we wanted to make sure that our communities had the right of first refusal, the opportunity to get to those appointments before anyone else could. And so we really created great intention. And so what is true, and I'll try to wrap up quickly here, what is true is that in those three communities, East Boston, Revere, and Chelsea, across the state of Massachusetts, those communities have the highest vaccination rates for Latinos as compared to any other zip code in the state. And that was the work that we all did collectively together to make that happen. So thank you to everyone in this room that contributed to that. Lastly, I'll just mention on COVID education. We were just turning out as much information as we could. We were receiving investment from our state partners, our federal partners, and we put that investment into the community in the form of these various strategies here. But quite a bit of activity, and some of it was successful, some of it wasn't. But what was important is that we had lines of communication with the community, with our community partners, to be able to pivot, answer the new questions that were arriving, and try to stay on top of all of this in real time. And so that was really the key to success for us in this. I'm going to ask you if you could go back to slide 7, if that's possible. Slide 6. There we go. So at least what we're seeing right now, and this is a little bit of the aftermath and where we're focused. Again, as a healthcare provider, we're responding to COVID, but we're responding to all the other challenges that existed before COVID and have been exacerbated since the pandemic. What we knew from some of our work, we did a community health needs assessment in 2021. A few issues rose to the top there. Number one, nutrition equity remains an issue. We know that well. So we're starting to build additional capacity to respond to those challenges around nutrition. If you can get further upstream with some of these issues around social determinants of health, there's greater opportunity to affect some of the downstream issues. Housing stability, also an issue. And we're continuing to engage in these assessments. We've also begun to really look at our data, our clinical data, and many folks were disconnected from care during the last 2 years. And so re-engaging residents in preventative medicine, is going to be really important. Those are the healthcare screenings that are so important. Early detection of cancer through screening is key. And so we're really starting to engage our patients and getting them back into the center and getting them engaged in these different screenings. We've seen an increased need for behavioral health services. One silver lining in the pandemic is we converted a lot of our care to virtual care and telehealth, and it's allowed us to actually get more people engaged in behavioral health services because it's just offered a more convenient way to access those services than coming in person. So we're continuing to see a lot of utilization of those services, but we need to expand because there are some new issues that we're dealing with, including depression in our communities. And then specifically to COVID-19 infection, where infection rates were disproportionately impacting Chelsea and other communities like Chelsea, we're going to see a disproportionate number of persons dealing with post-acute COVID-19 syndrome or PACS. And early detection of some of those symptoms will be important. They're elusive, and they take different forms in different patients. So we're starting to really get a good understanding of how to identify those challenges and get early treatment to our patients. And then again, acute behavioral health services and trauma-related support for families that have dealt with either the illness personally or within their homes, or have lost loved ones due to the illness. So I'm going to stop there just so that we can have a few minutes to talk, but do want to just acknowledge that the work isn't done. We have much more work to do together, and it's going to be done as a village. And so I thank you for your partnership and look forward to working with everyone here.
Thank you so much, everybody on this panel. And unfortunately, we're out of time, but this is a Latino community, so I'm going to have a little bit of space and say, does anyone have any questions for this panel? Online, any Zoom questions? Barry?
So one thing we heard in the community panel was how they have a shared vision. It's really important. Could you talk about, and how the three of you think about what shared vision looks like?
You want to take it, Greg?
So, I think that we're all just emerging from, COVID in some ways. And so now is sort of the prime opportunity for us to meet and come up with that shared vision. And it's awesome to meet in person here because in a few days you were going to receive an email from me about setting up a meeting because we want to discuss sort of what we're thinking for next steps on mobile and see how we can collaborate so that we're all working together instead of all of us working in silos.
Absolutely. I think the only comment I would add, part of this is building a playbook. I heard on the earlier panel, they were talking about how do we memorialize what was built here. Some of it was due to personalities and just people willing to come to the table with great commitment to facilitate important work. But how do we memorialize what transpired within this community that was different, so that whatever the future may bring, whether it's COVID or something else, that we've leveraged those strengths and those partnerships and the ability to respond to a disaster, which is really what happened here. So I think we want to really put that playbook on paper so that we understand our roles, we can mitigate some of those silos, and certainly leverage our respective strengths as we try to tackle the future. So I think it's going to evolving, but I do think it's work that needs to happen.
I completely agree. I think that's what COVID has basically brought. It has brought folks in organizations that usually don't, right, to a place of a must. And I believe that that's exactly what it needs to be. It's just one big playbook that needs to just be picked up whenever it needs to, just on any level, right? And I agree with both panelists that it's just once that is built, but again, we're all emerging now. It's like fresh, and dust is kind of like we're getting the dust off of us and saying, okay, now how do we tackle this as a unit? So yeah, no, I agree with both.
Well, thank you all so much, and I'm going to turn it over to you, Barry, who's going to be the facilitator to the next panel. Thanks, everybody.
Thank you.
Thank you.
All right, I think we're going to get started with the next panel. Nice to see everyone. Thank you so much for being here. My name is Barry Kippert. I'm the director of the Public Health Department at the Metropolitan Area Planning Council. I just wanted to start off by just saying how welcoming Chelsea is and just how appreciative I am. I'm not a resident of the city. I work for an organization that tries to serve the city, but just in terms of welcomeness and the invitation to participate and be part of your community has been really, really rewarding. So I just want to thank you all, and thanks really to the folks on this panel as well, too, for creating such an inviting community. So I just wanted to start off with that. So we've had a great opportunity so far to hear from community-based organizations in the city, what that work looked like, how it happened, how it involved city and municipal partners as well, too. We just heard from our clinical partners and the work that they did and how they interacted, again, with community-based organizations and with the city. And so now we have the perspective from the municipal side of it, too. So really exciting to be up here with Tom, with Floor, and with Alex. I'll let you all kind of introduce yourself if you want to as we go through it. But we're going to have a series of questions similar to the other format. move through those, and then we look to kind of really kind of engage with you all, kind of part of this, but later in the discussion as well. So Tom, I'm going to start with you. Can you talk to us a little bit about how Chelsea government has changed during COVID?
I guess two things come to mind when I thought about that question. One, I think our relationships with our local non-governmental organizations really were strengthened during COVID. I mean, pre-COVID, we had reasonably good collaborative efforts with our nonprofit partners, but they really just were so solidified during COVID because we became so dependent on each other in order to meet the crisis. And so I think if there were a silver lining in such a terrible situation, it was that the city and its nonprofit partners became much better at collaboration than we had been previously. And I would say probably the nonprofits themselves became better collaborators among themselves. So I think that's one way in which Chelsea government has changed. Better, stronger relationships which bode well for the future. I think the second thing that I've often pointed out is COVID did, I think, lead government leaders in Chelsea to think more broadly about the role of government support for its residents. So by that I mean this. Pre-COVID, it would have been a hard argument to make that local, municipal, and government should be involved in providing direct legal services to our residents. It would have been difficult to convince local government that it should be appropriating government dollars to supporting food pantries in the city. Even though, the needs always had existed, I mean, clearly before COVID, we had many, many residents in dire need of legal services. And we had many residents in dire need of food, really faced food insecurity. The government was well aware of both of those things, but we never saw our role as local government as, okay, we ought to be providing the service to residents. We thought that was a role for state government or for some other entity, not for the local municipality. We had our legal services department, and that was the extent of legal services we provided. COVID obviously required us to pivot and shift and start funding things that we had never funded before as an emergency response, but I think it also convinced elected officials and administration officials that this was in fact an area for government, for local government in which to be involved. And so now I don't think anyone raises an eyebrow when we talk about local government appropriating funds for general legal services for residents or for general food pantry support for within the city. So I think in that way, government has changed. We have a broader perspective as to what are the services we should, as a governmental entity, be providing to our residents.
Thanks, Tom, too. So it's just really interesting to hear how you got that dissolving of borders that may have prevented or not had people collaborating as much as they could, and then also that dissolving of essentially borders of where activities should or shouldn't, whose responsibility they are. That's really, really helpful. Another area I think that we've had to question during the pandemic is how do we really talk about and do work related to health equity? We know from the first Health Equity Forum, one of the things that really got highlighted was the role of partnerships, data and action, and a rapid response and its connections. As we think about the topic of health equity, could you talk about some of those places that are strengths that we need to make sure we maintain, but some of those areas we might need to improve as well?
Thank you for that question, Barry. Yes, definitely. I think data and action was crucial for our response, and we've also heard our providers talk about collecting data, to have that be what informs our interventions and our response. While we did, I think, a really good job at looking at our vaccination rates, case counts, and our wastewater monitor data for the local Board of Health to make a decision based on that, I think it's now going to be more important to sustain that and to expand that infrastructure. What I mean by that is having that cross-sector communication between our providers, government, CBOs, but also bringing that to the public, to our residents, having our residents see themselves in that data that we're collecting so that it is meaningful and it is easier to take action. So data is definitely, I think, key moving forward. Another area is communication. Communication, aligning our messages, that was key to sustain with the health department, our CBOs, and again, our providers, knowing when vaccination eligibility change. So in order to reach our community, the message has to be cohesive, and we do have to maintain and expand on communication efforts as well, and making sure that that is accessible, that it is accessible in not just written language, but verbal language, and that we're reaching our audience in the way that they are receptive to that information. And lastly, I think I'd like to continue expanding or expand who is included on the table. This echoes what Joan mentioned earlier. We've done, again, a really good job at including our Latino population, our Black African American population, and I think a multi-ethnic group. However, in a lot of my conversations, and even thinking beyond to emergency preparedness, what I think we're lacking is our homebound population and our population who have mobility impairments, who have greater, I think, needs and greater access needs. So that's, I think, the last area where I would like to amplify our efforts moving forward.
Thank you, Flor, too. And I'd be remiss too if we didn't add on to your point, at least from our conversations too, that like how important kind of that spoken word communications is, and we can have the data and we can have the relationships, but knowing what people are saying and what they're feeling, I know how you value that as well too, and so thank you for that. So in addition to the health and economic impacts of COVID, the pandemic re-traumatized a lot of the city's residents, especially around issues related to housing and food insecurity. Can you tell us how the Department of Housing and Community Development has integrated a trauma-based approach?
Yeah, so I think from our perspective as a department of 10 that focuses on issues around housing, stability, economic mobility, community development, the pandemic magnified trauma. There was a variety of trauma that was widespread in the community, that's spanned decades, both related to racial wealth inequities, related to economic repression and government persecution. It really spans the gamut. And the basis of a lot of the work that we do kind of starts with understanding that spectrum of trauma and what it is, where it originates from, how it is triggered, what the stressors are. Chelsea, the poverty rate is around 20%. And, a lot of research has shown that poverty is correlated with mental health, physical well-being, and public health outcomes. So when it comes to designing and implementing, programs, we try to take a collaborative approach that brings not just housing and economic experts to the table, but experts from mental health, behavioral health, organizing, a different variety of areas to create these initiatives and to implement these initiatives with us, and most importantly, to evaluate whether or not we're effectively addressing the root cause of issues that are affecting residents. I think secondly, a lot of the work that we do as a department is funded through the state and federal government. So we are oftentimes bound by the requirements of state and federal funding sources. And so this pandemic experience, as well as the work that we're doing to foster a just recovery, highlights the need for flexible resources, whether it's from the state, federal, or even local levels that don't have some of those rigid requirements that cause things like housing or domains like economic development to be very siloed. Ultimately, many of the programs that we oversee and collaborate with that are state funded, occur almost in a vacuum, and we've been making it a priority to kind of break down those silos in order to provide wraparound services and a variety of mental and behavioral health services to folks that are enrolled in rental assistance programs or job search programs, since all of the clients and all the residents that we try to assist have suffered some form of trauma or are undergoing some form of mental or behavioral health crisis right now.
Thank you, Alex, too. And so I think just to kind of connect your and Tom's comments as well, too, is that sometimes we think that the purview of some of this work is, if we talk about trauma-based care, it's only in the clinical system, but it's just so encouraging and really amazing to hear coming from essentially housing and community development, particularly within a municipal setting. So thank you for that. Tom, big question. How is the city preparing for the future?
So I think what became clear to us during the course of the pandemic is that we did not have the infrastructure within city government necessary to respond to a crisis of this magnitude. We had a director of Health and Human Services, and we had one public health nurse. That was our infrastructure. And obviously, a pandemic like this, we were woefully unprepared. So I think what we have started to do and will be doing over the next few years is to build up our internal social services capacity. No longer simply outsourcing everything we do with contracts, but trying to build internal capacity within a revitalized Health and Human Services department. And so, in addition, strengthening the regional collaborations that we've started to build through COVID. So I'll talk about both. So the regional collaboration, we were always part of a North Suffolk Public Health Collaborative, but prior to COVID, other than a meeting here or there, that collaborative really wasn't a cohesive effort. Since COVID, it has become very cohesive. We practically meet at least once a week, if not twice a week. We have a shared epidemiologist. We are doing our own contact tracing in an expanded collaboration with the city of Cambridge. So we've built that regional infrastructure, and that's, I expect, will continue. We are now looking to build our internal infrastructure. So we have a provision in the FY23 budget to bring on a Health and Human Services director whose first task will be a strategic vision for building a department and building internal capacity, with the commitment that I've already publicly made to the council that we expect to be building this capacity with new personnel and new programming over the course of the next few years, that this is a place where the city is going to have to invest to build up our internal capacity. We'll start by using some ARPA money, but we'll likely end as having this baked into our operating budget year after year. So I guess preparing for the future means for us building capacity way beyond where we were when COVID hit us.
Thank you, Tom, too. And I think many of us know, even from our own habits, right, how hard it is sometimes to not go back to an old habit. You kind of build that response for a moment, and sometimes want to fall back. And so just really interesting, again, to hear that kind of very forward look and kind of the push around that, too. So thank you, Tom. So Floor, going forward in your public health planning, and you think about the issues of advocacy, what are we advocating for? Who are we doing it to, and who with?
I think Tom answered a part of this question. As the Director of Public Health, I'm absolutely advocating for recognition of the role of public health in mitigating health inequities in a community. Public health is a convener. It brings CBOs, providers, research, academic institutions together to mitigate a problem that we know is cross-sector. Not one department, not one dimension is going to solve it because it is a broad, it's a broad system. So definitely advocating for more capacity in the department. I also think we need to advocate for more resources, not just from our community, but also from our state and our government in general. I think echoing some of the, not quoting verbatim, but one of Chris's expressions last year was, look at what we can do when we have the funds. We've transformed a city from having the highest cases of COVID to the highest rates of vaccination. And it is because we had funds from the state. We have an ability to fund our ambassadors, many of whom are present here right now. And so in order to reach our goals, our public health goals, we need support, financial support to do that. Again, this is the question that our CBOs answered so eloquently. We're advocating with one another, and our providers also echo this. It is going to take a village to tackle the inequities that we see in the city. It's chronic. It's not just because of COVID. It has been a long-standing issue. I was raised in Chelsea. I've lived here since the age of 9, and I'm really excited to be part of this change right now because I think that is what we are seeing at this moment. It is a pivotal moment that we're in. And as a resident, as a person who also has family here, never before have I heard or seen or experienced this momentum and just, I think, advocacy for public health. So yes, speaking to all of us, for all of us at this moment.
Thank you, Flora, too. And I hear you lifting up kind of, again, that difference sometimes that we draw between equity and equality, right? Sometimes equality means we're giving everybody the same thing, but that's not what we're looking for here. We're looking to go deeper in a sustained way, in a way that kind of meets people where they are and again gets us to a place of wellness. So,
absolutely.
Thank you. Alex, I think picking up on a point, Flora is really touching on the fact that it's kind of all of us. Housing is critical to the intersectionality of applied local public health. Knowing that, what are the key priorities for the Housing and Community Development Department, and how are you aligning with public health priorities?
So we have a lot of priorities, particularly as we're emerging from the pandemic, but I'll hone in on a handful, starting with housing stability. And I think one of our key priorities that we're advocating for both at the state level as well as distilling into programs and policies at the local level is employing a housing first model, recognizing that residents can't overcome many of the obstacles and the pernicious inequities that they face without having safe, secure, affordable housing. You can't get clean if you don't have a safe apartment that you can afford that month. You can't overcome mental health challenges if you don't have a place that you feel safe in, that you feel like you have refuge in. And so identifying and driving an agenda of affordable permanent housing as well as supportive services is at the forefront of our housing agenda. On the sort of resilience side, the pandemic, I think, highlighted for many people outside of Chelsea the interconnectedness between environmental factors like air pollution and contamination and public health, and how that makes communities like Chelsea vulnerable. Communities like Chelsea with predominantly residents of color are inherently more vulnerable to future pandemics as well as to poverty and other economic issues than more affluent white communities. So we're focusing a lot on social resilience, both addressing the social systems that are in place or should be put into place to ensure that when we have another disaster like a climate event or another pandemic, we can bounce back quicker and in a more healthy fashion. And we're also tackling the built environment as well as the general sort of environment by tackling issues around heat and air pollution and contamination, since those are interconnected with public health. Lastly, on the economic front, as we're kind of emerging through the coming months, the economic recovery that lays ahead is already falling into place to look like the same economy that we had before the pandemic. And that was the economy that, exploited workers in Chelsea, that depended upon cheap labor. And we're advancing, numerous initiatives right now to attract high quality, sustainable living wage jobs to Chelsea with benefits and high wages that residents can, attain and see some upward economic mobility. Simultaneously, we're deepening our efforts in workforce development. This wasn't a place where the city was active before the pandemic, including, job navigation services and funding workforce training, both in the construction trades, professional areas, as well as healthcare and education, in order to work with residents to attain new employment and skills going forward. So I think we see it all as interconnected, but we do, see the macro elements of the economy, both the housing market as well as the job market, beginning to revert back to how it looked before the pandemic, and it's deeply worrying.
Thank you for naming that. And I think that is a real worry, and it's great to hear about that work. And I was going to just connect the one, I think, Sarah in the first panel to use that term exposure. And you brought that up, and like, what are the changes that we can do to make sure people are being exposed to more environments, more conditions that really support well-being, as opposed to some of the ones that could cause greater risk and harm. Well, I'll just pick up on that note, Greg, just to end us too, that I think sometimes we can think about government or kind of our municipal partners as kind of being back on their heels, flat on their feet or on their toes. But I think based on the conversation that we just had here, we see you all are on your toes, leaning forward, right? Thinking about what is that kind of way that we can lean into and be actionable around these problems and do it in a collective manner too. So thank you for joining us today.
Cool. All right. Hi, everyone. Welcome to our last panel of the day, our home stretch. But we're going to be talking to the external partners today, so I'm really excited to hear from you all. I know I've had less of an opportunity to work directly with some of you, so I'm excited to hear everything that you all have to say. I think we're going to get the slides up soon, but maybe we could get started and folks could start introducing themselves and addressing the first question, and then when the slides come up, we can transition back into that, if that sounds okay? Sure. Great. Cool. So I think our first question is going to be for the Chelsea Project and IDX 20. Both of these institutions were founded in response to COVID. I guess we're wondering, like, what has surprised you the most in the implementation of the projects that you all have been working on, as opposed to how you originally designed and envisioned them? You can start first. Yeah. And I think your slides are up if you want to use them as well. Yeah.
Okay, so good afternoon, everybody. So my name is Serene Bosch. I'm representing here IDX 20. It's a small startup that had been with the pleasure to work with the Chelsea Project for the last 3 months here in Chelsea. With us, we have our team members, Daniela, Alexis, and Jose Gustavo, so thanks for being here. So basically what we have been doing is testing the community that the Housing Authority had put into our portfolio of projects to work. And it consists of testing people who live in those 2 big projects once a week. And the whole idea, and part of what I'd like to answer your question, is that we learned that if you have a regularity and a frequency of testing COVID in the community, it gives a tremendous advantage, because otherwise you would not be able to detect cases of COVID as they appear, and therefore you won't be able to quarantine and protect the rest of the community. So this project consists of a very affordable rapid test, and I'll explain later why it's so affordable, and that allowing people to know very early if they have the virus. So your question again was about what we have learned from doing this experience, right? Or do you want to phrase it again here?
Yeah, I think it was kind of about just what has surprised you in the implementation of your projects, like what was surprising to you all or new? Mm-hmm.
Yeah, so one of the good news is that the community that we are working with in Chelsea is very positively participating. So we started with 400 people that had the capacity to enroll, and we were able to enroll, let's say, 50% and continue through the months, even after Omicron had passed, which is the months of December and January and February, Chelsea, as well as other parts of the country, experienced a big surge of COVID, which was called Omicron. So even after the Omicron wave had passed, we were able to maintain a consistency and the sense of protection and the sense of assurance and understanding what this antigen test for COVID do. So it's a huge sort of benefit of learning that we were able to do that. Do we want to expand that? Of course, and that's what we will, briefly talk about as we go in this panel.
Cool. Thank you for that. Do you want to go through your slides really quickly? I know they're up.
Is this for me?
Mm-hmm.
Okay. So the next one? Oh, yeah. So now that we're just looking at some slides, and there are just a few slides, I wanted to introduce you and all of our audience to what we will face in the next couple of months. So with a very important coalition of the City of Chelsea and Flor here, I have to say, 99% of what we do depends on your very positive collaboration. We will be then embarking into almost a year-long project, and that is consisting of working again with a testing frequency of about a week or biweekly, and us as a company that is interested in providing these tests to the community. And in the next slide, this is a unique opportunity because there were two big grants offered in the whole country. One was given to the Beth Israel Hospital, the other one to this team, and Samantha's here as well, and thank you for that. And the basic idea is that tests that are antigen for COVID can be super affordable, and the way to do that is to validate and study these various tests that we have in our hands so that to show that they can be a really good tool for monitoring disease. So one of the objectives that we will carry on is to validate this significant amount of tests that are not ready to enter the market, but are as good as any other that are already in the market. And we do that with analytical tools. And in the next slide, we take the opportunity to validate these tests and simulate how they work in the lab with demonstrating with real-world application, like the one we're doing here in Chelsea, that people are able to use them in their homes, use them in their communities, and have the results immediately, whether there is a presence or not of the COVID virus. On top of this task of validating tests, we want to also demonstrate that there might be a way to communicate the data through the cell phone and digital tools. And this is the technological part that we are so much interested in doing because it allows the individual to know immediately in real time what the result of the test is without the intervention of a health personnel. So that digital platform will be developed within the next couple of months. And then lastly, in the next slide, we will then learn how to report the data that we get in these devices to the authorities and the health authorities so that we have something that was mentioned here before in this forum, the very crucial communication between decisions that the city has to take to protect their individuals and what we find in the research. So that piece of how do we communicate all the data gathered through the months eventually to the health authorities, that's also part of what we need to do through this project. And I think this is it for the project, for the aims, and just want to have the last slide. Yeah. So basically the outcomes will be, of course, to look at the performance of these rapid tests. They're of great use because their prices eventually in the community will be very affordable to what comparatively is now, and also then learn more about surveillance and mitigation of COVID in general. And in the audience, of course, we have people with lots of experience doing that with wastewaters and with other interventions. So ideally, this new project will link to the epidemiologists that exists here, to the epidemiologists that had been working for the last almost 2 years, so that we have two branches, wastewater monitoring and rapid test human monitoring. Because the rapid test itself is not just a diagnostic tool, but it's a monitoring tool. That's basically sums the project. And then I think, Flor, that's the last slide. Yeah, so we can continue.
Yeah, thank you so much for that. I know something you mentioned is like your relationship with others, with Flor and with other partners. And so, Sam, I was thinking this might be a good time for you to come in if you want to pull up your slides and you can get started.
Yeah, no problem. I'm really happy to be here today. Thanks for inviting us. So yes, as Sarah was mentioning, we wanted to present the Chelsea project, which actually Dan is a member, Barry, Chris, and Flor, and Karthik, and then obviously we're working really closely with Serene and all of her team here today. So it really is a collaboration that reaches across many different entities within Chelsea, and then myself and Karthik Dinakar are actually researchers from a nonprofit called Center for Complex Interventions, and really what our focus of our work is around bringing science to communities and really understanding that when you're implementing scientific solutions, you really have to understand what are all the second order effects of those programs. So how does, Irene mentioned wastewater as like a big thing that we did. How does wastewater connect to the community, to the testing program that we're implementing now? Because all of it needs to be connected in order to be successful. So on the next slide, I can go through just a brief overview of the things that we've done. So we started early on in the pandemic, and really there were 3 different major interventions, and they're all related. The first was to implement wastewater testing, and this was, I think Chelsea actually was one of the first cities to do this. We installed wastewater samplers in 4 different areas of the city to really get a sense of how prevalent COVID was overall, but also to figure out, are there certain parts of the city that are going to be experiencing spikes in COVID? And then what we were able to do with that data is share it with the community. So we shared it with Priya's team, who had the mobile testing van. We shared it with Chris at La Colaborativa and the Promotores program, so that they knew, okay, which areas should we be going to talk to people about getting tested? Because that's really what we want to be doing, is catching people before they spread it to others. So that's the targeted PCR testing. And then, of course, the community-led communication is really focused on Chris's great work and the Collaborativa's great work on the Promotores program, and really educating residents about COVID. So it's the COVID education piece, but then also learning from the community in those conversations. So really understanding what are their concerns about COVID, what are questions that they have, and then the Chelsea project team could go back to our academic networks and figure out, okay, can we give answers to the community that can help move this forward. So on the next slide, we talk a little bit about our current focus moving forward. So as Irene mentioned, we have this great research grant from the FDA to continue the rapid testing program. We're really excited to do this work because we feel like now that we're entering this new normal where COVID will always be a part of our reality, it'll be really important to educate people about how to keep themselves safe. So yes, we'll have the wastewater to kind of give us a sense of overall prevalence, but people also need to understand what are steps that they individually can take as we see new variants, as there's probably future spikes of COVID, to keep them and their families safe. And then the other 2 areas that we've been talking a lot about internally are whether we could expand the Chelsea model to other neighboring towns. I think we've got some interest from a few towns, but we really need to understand what are aspects of the Chelsea project that can be replicated. Because obviously Chelsea is a very unique community, and all communities are going to have different challenges, so trying to figure that out. And then the third aspect is just something that we learned, especially through our work with the Promotores, is that one of the key, I think, gaps that we were filling was this communication of what is the research, like what is the latest happening in the scientific community, and how do we get that to the community itself? Because really that's a very hard gap to fill, and especially in real time. So that's one where we're like, okay, we did a good job in COVID, but how do we do this more broadly and on a more consistent basis? And then I think the next, I don't know what the next slide is. I don't remember. Oh, okay, summary. Yeah, so just summarizing. Just identifying infrastructure that we've already implemented, and the main example here is wastewater, that we really should continue and find a way to make it sustainable financially. So Flora mentioned this about just really making sure we're investing in public health infrastructure moving forward, and our team sees wastewater as definitely number one, and I think a close second is this rapid testing. Like, how can we make that something that is just a part of our everyday lives? The second is continuing and improving the data sharing, which I already mentioned. So finding a way to make that more consistent. And then finally, trying to share our learnings with other towns. But then also, I think this was mentioned in the CBO panel, trying to share that more broadly. So one thing that our group's also talking about is publication. I think both the general, more like public, general public needs to learn what we did, but actually I think the academic community really needs to understand what we did here as well, because I think that although there's so much great research going on in the academic medical communities, it's very hard to reach people in their everyday lives, and so if there's ways that we could get others to see how they might be able to do that better, I think that would be good for everybody. Yeah, thank you.
I think one thing that you touched on was about how COVID is part of this new normal in our community now. Yeah. I think that's really important to think about in the context of like institutions and residents maybe losing interest in talking about COVID or doing COVID-related work. So I think a question for all three of you is, what parts of your COVID response and your COVID work do you think can be applicable for the future, and how do you plan on continuing to do that? And anybody can start. Yeah, you can start.
So maybe what I can do is just do a brief description of the hub. Start my little timer there. So the hub is actually an internal partner. It's made up of organizations, all sorts of organizations in the city. I'll just name off a few. It's led by the Chelsea Police Department, but it is not owned by the Chelsea Police Department. It's owned by the city. And so, for example, the schools, DCF, Department of Children and Families, Cambridge Health Alliance, Chelsea Housing Authority, MGH, North Suffolk Mental Health, the courts, Elliott, Human Services, CAPIC, Bay Cove, East Boston Neighborhood Health Center. They have an East Boston Hub, Housing Families, TND, Boys and Girls Club, Kind, Pear, Mystic Valley Elder Services, Rosie's Place, DTA, DHCD, the Neighborhood Developers. Those are all organizations that come together every week at the police station to take a look at individuals and families that are highly at risk. And then teams are mobilized. We go do an intervention, and then we try to connect them to the services that they need to get them out of that risk. And then we report back to each other. So we meet every week to do that, to get families and individuals out of harm's way. So I think in many ways the hub is a model for how a lot of the things that we've done in the city since 2015 have come to be, including the Chelsea Project, because it creates a hub mindset. It's a rapid response mechanism. It gives you this can-do attitude, like if there's a problem, we know we can fix it. It's the ultimate silo buster. I think one of the health presenters was talking about not working in silos, and that's what we do. I just want to give you a quick example. One of the community partners that's in the room today had an issue where an individual was struggling with mental health issues became a threat to them, right? He had mentioned about buying guns, and they were very concerned. They might have just shooed him away in the past, or maybe called the police, and the police probably wouldn't have known what to do other than to make sure they cleared him out of the way, right? So we were able to dig deeper and find out what happened in partnership with the organization, what happened in this person's life. Why was this person doing this? Why is he being kicked out of his apartment? And currently, just so you guys know, he's in a safe place. But those connections all happen with fast phone calls, and that is the mechanism in which people are going to get out of harm's way. So we in the city have a hub mindset, and we're very proud to work under the leadership of Tom Ambrosino, because he fully supports the hub. The Police Chief Brian Keyes and Captain Dave Batchelor, who it's under his community services division. It's how the police department is putting the people that are at risk in the hands of the housing professionals, in the hands of the substance use professionals, in the hands of mental health professionals, so the police don't have to interact with them. We communicate very frequently and consistently. We meet on a weekly basis and have developed many channels of communication, which when Karthik called me at the height of the pandemic and he was telling me all these things that MIT wanted to do, I was like, you don't need to be talking to me. You need to be talking to Barry. You need to be talking to Tom. So that's when we started to have more broader conversations, and that's sort of how the Chelsea project evolved. I knew that I wasn't the person to do that other people would do that. So I think in my role, I serve as a connector. I know that this person does this, and I know that person does that. You guys talk, and then I'll be on my merry way. And, I think that that's ultimately why Chelsea is as successful as it is. The eviction task force is modeled loosely after the hub, and I think the hub is great, but the eviction task force is incredible. It started off as a way to support individuals that are facing eviction. Now it's just homelessness in general. And what Alex does with that team is incredible. We created the Downtown Task Force for an audience of one, Mr. Tom Ambrosino. He comes every week, every Thursday at noon. He meets with the team that includes the police, the outreach workers, the navigators, CAPIC, the courts, everybody's there, inspectional services, and we take a look at why certain areas of the city are problematic, why people are overdosing here, why do people feel unsafe here, and then we respond very quickly, and we provide updates via photos for Tom to make sure that he's happy, and then the city feels better. It's a great way for us to be. I'll just end with this. When I first started working in Chelsea in around 2013, 14, people used to walk over people on Broadway that were passed out. They would walk over them or around them. Now I'll get a call saying, Dan, there's a woman, she's passed out at the bus stop, and it looks like she needs help. And so I'll send a navigator, because I can call him right away. The navigator gets her 2 minutes later, and he calls me back and says, Dan, it's a college student. She was just taking a nap on the bus stop, and she's fine. Because we went from not knowing who to call. We went from, that's Chelsea, what are we going to do, to I know where help can be, because that's extended to the residents. And let me answer your question. Well,
so I was asking, what are the aspects of COVID response and testing that you want to, that should remain in Chelsea moving forward?
Well, I think that the members of the Chelsea Hub here, we're approaching 1,000 individuals and families that we've interacted with another 300 or so that we took care of, like this individual that I'm talking about. He's never going to be, he might be presented on Tuesday, but that was presented to us very recently, and we mobilized very recently. So I think the hub is sort of like a landing spot for issues that families and individuals are facing that are impacted by COVID. So during COVID, we met virtually. We were very worried that we weren't going to be able to continue the hub, but we figured out that, just like everyone else did, that we can do it virtually. And our situations, we don't call them cases, the situations rose. We went from 2 to 3 a week to about 7 to 8 a week. And these are families that were facing eviction. These are families that were facing all sorts of problems, utilities. So I think for us, it's a great way for us to have a pulse on the families that are mostly at risk.
Cool, thank you. Renee or Sam, do either of you?
Oh, sorry.
Maybe if we dim the light, would not do it, but I'm not sure.
Club version of the show?
Yeah, this is a fun panel.
So if I understand your question, we're trying to discuss basically challenges ahead and what to do basically with this new phase in which we are. So I just want to announce something. We don't know what COVID is going to look like because nobody knows that. And if you say well, it probably is not true. So with COVID, everything is new. This is a pandemic that happened to the whole world, and nobody has the authority to say, no, we don't have any more COVID. Why do I speak like that? Because viruses are really clever, because this is a new virus that is in our human population and is changing a lot and rapidly. The one thing that is actually very true is that if you are vaccinated and you are protected from this disease, the numbers of cases will go down. So just to put that in perspective, we all see the ups and downs of the epidemic in the last 2 years, almost like a mountain that goes up and down. And that probably will persist for a while. And a while could be another year, 2 years. We really don't know. In the face of that, scientifically speaking, problem, it's a huge challenge for the health authorities because it's hard to predict what to do, right? Where do you put the resources? How do you predict where the main problem might be? So apparently CDC have said that perhaps it's not so much on cases, but per se, but cases that go to hospital. Well, we don't really know that. So one big conclusion that I would come to say today is that let's do what we know what to do. Let's do something that is easy enough to do. And one of those easy things to do is to test the population with an affordable way to do it. Mm-hmm. And also do it fast, so that fast means the moment that I have the virus, he knows. Mm-hmm. So that's what it's called, fast. And that I can see it. So of course, if you go to the hospital, then you can get diagnosed the next day, but that's a lot of resources that go into do that. There are many other ways to do it. So if we, in my opinion, we should continue eagerly the antigen tests. Nowadays, the antigen tests, the little cassettes you have, are 100 times better than they were 2 years ago. We were there in 2020. We're now in 2022. We know that. So I totally are very convinced that one way to go ahead is to be in the prevention mode and be very attentive and protect our population by testing. And even though it could be an effort to do it as a routine, we can learn how to do the routine the same way we brush our teeth. Because I'm sure sometimes you don't want to brush your teeth, but you have to. So anyway, that's how I see moving forward. And then, of course, with the public health, hand-to-hand with what we do as a research project, it's crucial. Because the population looks at them, at those umbrellas to enact and to do what they do. So we do need to work closely with the health authorities in Chelsea.
I think the only other thing I would add, I love what Irene said, is just that emphasizing to people, because I do see that it's difficult. You know, people feel like, oh, the pandemic's over, or we're in a new normal, and we just kind of accept where we're at. And I think to Irene's point, this is the time for preparation. It's like, you know, if we take steps now, then if there is a spike, we'll be ready. And I think the other thing to do is just explain how things that we learn from COVID can apply to other things too. Mm-hmm. I think that linking the lessons from COVID into more general public health it might be a more effective strategy. And I'll also mention that's the other reason we think wastewater testing is important to continue, because it is a really low-cost way to continue monitoring and collect data. And you know, everyone contributes, but it's anonymous, and no one has to really make any effort. So.
I just want to quickly add that we learned that, because when we train other communities to launch hubs, by the way, we just launched Holyoke. So Holyoke's starting their hub. They're the 17th in the state. And by the way, we were the first in the country, got it from Canada. And when people started to hear about our hubs, they started to ask if we could help them. Now we do it very formally. It's a really wonderful thing. But we explain how, yes, we have the hub, but we also respond very quickly to everything. So seeing Deanie and Gladys, I think to answer that question, we're ready. We're going to respond, you know, with the work that Chris does and everybody else is part, not just part of the Chelsea project, but everybody else in the city. You know, we're battle tested and battle ready.
Cool. Thank you so much for that, Dan. I know we are coming up on time, but I do want to end on that note and just ask you all to briefly talk about, like, how are ways that you're going to plan on replicating the work that you're doing. I know you mentioned that you've been doing that already, so would love to hear more about that from all of you.
Okay. Yeah, I mean, I think that, like I said, we're looking at if we can replicate things we've learned here in other cities. But I guess I'd just go back to what came up in some of the other panels about trust and building relationships, because I do think that that's at the core of whatever we do next. I think building trust with the community as we move forward and answering questions, as Irene did, like very bluntly, and just being like, we might not know. Like, we're going to try this, and we're going to learn what we can. So I think that that's the main thing, is really trying to see this terrible experience that we've had as a catalyst to change how we operate moving forward and to really make the most of the relationships we've built.
Yeah, and that's really important because, you know, we've all been on a lot of calls with other cities, and then they'll explain what they did, and you're like, wow, that's like 20% of what we did. Mm-hmm. You know, other cities have done really good work, but I don't think any city has done it as consistently and as collaboratively and as effectively as we have. So earlier when Joan got everybody to, a round of applause for everybody, that's very true because people work their butts off, and I think we've done it. I think we were hit the hardest in the state and possibly in the country, but I think our response was better than anyone's.
No, I think that it's well said. I don't have much to add on that, but other than I want to take the opportunity to say that what we're doing here in Chelsea is unique. Therefore, I'm sure other places will learn from what we do here. It's unique because even the Food and Drug Administration, who will be watching us, they don't know what to do.
We need to go nationwide.
Anyway, but it is a pleasure and love to have time to hear from the audience as well.
Yeah, maybe we could take like 1 minute if there's any questions that people want to ask or thoughts they want to share.
Everybody wants to go.
All right. Well, thank you all so much for being here. And I know that I know Sam and Irene, we haven't had a lot of chance to work together before, but your work has really informed a lot of what we've been doing too. So thank you all, and thank you, Dan, for your partnership too.
You bet. Thank you.
Oh, okay, Tom, I'm going to invite Tom back up to give some closing remarks.
Well, I'm going to be very, very brief. First, I just want to thank everyone for taking part in today's event. I really do think it's important to take a step back, think about lessons learned through a crisis like we've been through, and really think hard about how can we be better prepared for the next one. I'm not sure that we can be so certain that the next crisis is going to be, another pandemic or even a public health crisis. It's quite possible it could be some climate crisis or some crisis caused by a foreign enemy of the United States. Who really knows what the next critical problem facing Chelsea will be? But I think we've learned that to emerge from any kind of crisis like that, we have to maintain these strong collaborative partnerships that we've had with our social service organizations, and the city has to create its own internal infrastructure. We have to be better prepared than we were for when COVID hit in March of 2020, and I think we will be based on what we've learned during the last 24 months. So again, I just want to thank everyone for taking part. I think now Barry's going to take over and moderate some sort of working session. I'm going to have to bow out, but again, the city very much appreciate all your time and effort for this forum.